Good afternoon. Today there are 17,144 cases of COVID-19 in Alberta. That's 1,685 new cases on 18,432 tests for a positivity rate of 9.2%. 504 people are in Alberta hospitals due to COVID-19, 97 of whom are in intensive care. And sadly, 10 more Albertans have passed away as a result of COVID-19, meaning that 561 Albertans have lost their lives due to this pandemic since it began. On behalf of all Albertans, I extend my condolences to the families and to the loved ones of each and every one. To those at home and in hospital fighting this disease, and to those who care for them, please know that Albertans have your back, and we're doing everything we can in our power to support you. But amidst all this heartache and loss, hope remains. Around the world, there has been great progress on the development of COVID-19 vaccines. We know that effective vaccines from Pfizer and Moderna will be ready for distribution here in Canada within weeks. And while we cannot control when these vaccines arrive in Alberta, we can make sure that when we get them, we are ready to roll them out as quickly as we can. That's why today I'm pleased to announce that I've appointed Municipal Affairs Deputy Minister Paul Winnick to lead Alberta's COVID-19 Vaccine Task Force, a multi-disciplinary team drawn from across the public sector, the public service, that will execute Alberta's vaccine distribution. This is an absolutely critical task, and General Winnick will walk through some of the specifics of it in a moment. Smooth and rapid vaccine distribution will not only be essential to our economic recovery, but they will be a matter of life and death for many Albertans and their families. Before I continue, I want to be clear. Alberta's government will not make any mandatory vaccination. Some think that this is controversial, but we don't live in a country where government can inject you with something against your will. In this, I follow the spirit of Sir Wilfrid Laurier, who famously said that, quotes, "I'd rather try the way of persuasion. There is more to be gained by appealing to the heart and soul of men rather than to compel them to do a thing." In fact, Alberta's government will soon amend the Public Health Act to remove that power of mandatory inoculation that has existed in law since 1910. But we need as many Albertans as possible to get vaccinated, and let me be clear about that. I will certainly choose to receive this vaccine when it's my turn, and I strongly urge others to do so. General Winnick proved he's up to this critical task earlier this year when the first wave of the pandemic hit. Under his successful leadership and logistical planning, he successfully spearheaded the Provincial Operations Centre of the Emergency Management Agency and their effort to both procure and distribute masks, gowns, gloves, face shields, and more amid a global rush for personal protective equipment. And he also helped to coordinate Alberta's successful Bits and Pieces program, which led to some real successful product development for critical medical equipment, including ventilators. Prior to joining Alberta's public service, General Winnick served as an officer in the Canadian Armed Forces for more than 38 years, rising to the rank of Lieutenant General, Commander of the Canadian Army, and Vice Chief of Defence Staff. And so I'm confident that he will serve Albertans well and that this enormous logistical challenge will be run with his usual military precision. Alberta Health and Alberta Health Services are very well advanced in developing our vaccine distribution program. I'm happy to report that Alberta is well prepared to receive, distribute, and administer a vaccine as soon as doses arrive. Alberta Health Services already has 13 vaccine depots throughout the province, all of which can receive and distribute the Moderna vaccine. It needs to be stored and transported at minus 20 degrees, so it does require special equipment. There are another 17 non-AH facilities that are also able to handle vaccine storage, meaning that there are a total of 30 vaccine depots across Alberta. The Pfizer vaccine, on the other hand, requires ultra-cold transportation and storage at 80 degrees below 0 Celsius. Currently, 3 of our 13 vaccine depots can receive and store the Pfizer vaccine, and AHS is working to expand that capacity as we speak, ordering additional freezers and related equipment. In Phase 1, during the first 3 months of 2021, we anticipate that we will be able to administer vaccines to approximately 435,000 Albertans. That's a little more than 10% of our population. Both the Moderna and Pfizer vaccines require 2 doses to be fully effective, separated by 3 to 6 weeks. So vaccinating 435 Albertans means administering about 870,000 doses. Not all of this will arrive at once. We've been assured by the federal government that shipments will begin to arrive by January 4 and continue to arrive in waves throughout the early part of next year. Alberta Health Services, Public Health, and the Workplace Health and Safety Branch will administer vaccines in Phase 1, which will focus entirely on Alberta's most at-risk populations. This is fully in line with the recommendation of the Special Advisory Committee on COVID-19 vaccination that has been a collaborative effort between the provinces and the federal government. That includes residents of long-term care homes and designated supported living facilities, staff who work in those facilities, on-reserve First Nations, and healthcare workers most needed to ensure workforce capacity and most likely to transmit COVID-19 to those at greatest risk. Phase 2 will be run from April to June, by which time our goal is to have 30% of our population immunized. Part of General Winnick's job will be to identify priority groups for Phase 2 based on what kind of uptake we've received in the first phase, together with, of course, input from our medical experts at AHS and Alberta Health. By the summer, we plan to begin Phase 3, where vaccine will be offered to all Albertans. And that means it will be months before vaccine is available to the general population. This is the unfortunate reality that Canadians across the country face and people around the world. Obviously, the risk of hospitalizations and COVID-19 fatalities will decline significantly once we're able to vaccinate the most vulnerable. But let's be clear, all of us will have to continue following public health guidelines even after the first wave of vaccinations have occurred. Now, I know people are getting tired and frustrated, but this is evidence that there is light at the end of the tunnel, and we can see this critical juncture when we will get past the terrible damage that COVID-19 has caused for our society. So my message to Albertans today is this: we are ready for the vaccine, and we have a plan to get it out to you as quickly and as safely as possible. Of course, there will be updates and changes to this plan as more details around vaccine delivery become available and as the phases of this plan are announced. And we appreciate that other vaccines may come on stream following trials, which could accelerate the distribution schedule. On the other hand, given the huge logistical complexity and global demand, I think we can also expect delays along the way. Today's about ensuring that Alberta has the team and the plan in place to complete this critical task. This pandemic has had unimaginable impact on our lives and livelihoods. Getting a vaccine to Albertans and all Canadians is the best way to protect both. In closing, I know that COVID-19 has changed everyone's lives in ways that we couldn't have imagined just 9 or 10 months ago. Most people have followed public health guidelines and made real sacrifices to protect our loved ones and the most vulnerable. Yet still, thousands of Albertans have lost someone that they love, and we're seeing a rising number of outbreaks in our long-term care centres. This past spring, Alberta's government took extraordinary measures to protect our healthcare system from being overwhelmed by this virus. Many Albertans selflessly chose to forgo time with family and friends, to shrink their social circles, and to cancel important life events, all to do their part to bend down the curve. And now we're asking you to do it again. It's up to every one of us to do the right thing and abide by the new measures announced last week and all of the public health guidelines and restrictions. That's the only way we reduce the spread and lift those measures as soon as possible while protecting our healthcare system. And with that, I believe I'll hand it over to Minister of Health, Shandro.
Thank you, Premier. And I'm delighted and proud to be part of today's announcement. For months, we've all eagerly awaited news that a vaccine is on its way in Alberta. Now that day is almost here, and we will be ready. Deputy Winnick is a proven leader. He has the skills and the track record to ensure that when a vaccine arrives in Alberta, it's delivered to the people who need it as fast as possible. Today's announcement builds on the hard work that the Ministry of Health and AHS have done for months to respond to the pandemic, including bringing COVID vaccines to Alberta. Since last spring, the Ministry of Health has been working with the Government of Canada to maintain awareness of available vaccines and to implement a national bulk distribution system. We expect to receive enough vaccine to immunize more than 400,000 Albertans in the first quarter of 2021, hopefully starting in early January. As Premier mentioned, we have a distribution plan ready to go. We expect the first shipments to arrive early in the new year once they've been approved by Health Canada. As Premier said, these vaccines will not be shipped all at once, but in multiple shipments over several months. The Pfizer vaccine will go directly to 30 different administration sites around the province, and the Ministry of Health has already begun acquiring the necessary ultra-low temperature freezers to store the Pfizer shipments at these sites. We'll also expect to receive enough doses of the Moderna vaccine to immunize even more Albertans during the first quarter of 2021. Now, unlike the Pfizer vaccine, the Moderna vaccine doesn't require ultra-low temperature storage. And we've been preparing for both of these vaccines for months. Officials from the ministry and AHS have been working tirelessly to chart a path to ensure that the vaccine is distributed as rapidly and as safely as possible, and based on evidence-based criteria to determine priority. This includes working with our federal and provincial partners through a variety of key working groups and committees. Our single provincial health authority gives us some clear advantages here in Alberta over many other jurisdictions when it comes to a logistical challenge like this one. AHS is a world leader in this kind of work. We'll use their network to ensure that the vaccines get to the right place at the right time, and to get those vaccines to patients safely and efficiently. However, there's still a lot of important work still ahead of us. Deputy Winnick will work closely with my ministry and with AHS. Under his guidance, we'll continue to build on the incredible progress that we've made so far to ensure an effective and safe vaccine rollout. In the meantime, it's important to keep in mind that the first shipments of vaccines will be targeted to specific high-priority groups. Work is underway right now to define those groups and the order to deliver the vaccines to them. Obviously, there are two top priorities. One is the folks who are at highest risk, including seniors who are in continuing care. And then the other is the healthcare professionals that we rely on to care for those most vulnerable Albertans, including those in continuing care and those who are working in our ICUs and other health services. Those healthcare professionals are tired and they need every support that we can give them. So I want to echo what Premier just stressed just now. There's a light at the end of the tunnel for all of us, for the public, for patients, and for healthcare professionals. But we haven't yet reached the other side. And we cannot relax once the vaccine arrives. So I urge every Albertan to continue to follow public health advice in order to limit the spread of COVID-19 throughout our communities and to keep us and our loved ones and our healthcare professionals safe. Thank you. I'll now turn it over to Deputy Minister Winnick for his comments.
Thank you, Minister. Good afternoon. Throughout the spring, I was privileged to work with a team of public service professionals to procure and provide personal protective equipment, or PPE, to critical service providers who were at the highest risk of exposure to COVID-19. This included getting PPE to businesses and non-Alberta health services organizations, including municipalities, essential service providers, emergency service providers, and non-government community and social service organizations. Now, as we prepare for the next phase of Alberta's response, I am honored to build upon our experience from the spring, to work with a dedicated multidisciplinary team to refine and implement a targeted distribution plan, and to assist in getting COVID-19 vaccine to our dedicated healthcare professionals to vaccinate the most vulnerable. As the Premier stated, Alberta is ready to receive its first shipment when it becomes available. Planning has been underway for months, and we are well prepared to move forward. The COVID-19 Vaccine Task Force will be working very closely with Alberta Health and Alberta Health Services to put our plans into action. Alberta Health will direct the delivery of vaccines and use the provincial vaccine depot and Alberta Health Services depots to distribute the vaccines. Alberta Health Services is responsible for the vaccination implementation process, including administering vaccine through public health clinics and nurses, setting up the depots, distribution logistics, and the quality assurance. The task force will support the planning and the execution with oversight and coordination. I look forward to the challenge ahead, and I want to be very clear that I do not look at these vaccines simply as objects to deliver or a work task to complete. Each and every dose of vaccine represents an Albertan who needs to be protected and is vital to protecting not just their health, but their livelihoods as well. My commitment to Albertans is that we will do everything within our control to ensure no Albertan has to wait any longer than absolutely necessary. I look forward to working closely with Alberta Health and Alberta Health Services and building upon the tremendous work that their professionals have done to finalize our plans so that we are poised to undertake this critically important task. Thank you.
Thank you, Deputy Minister, Minister and Premier, and good afternoon, everyone. As you heard from the Premier, today over the last 24 hours, we have identified 1,685 additional cases of COVID-19. Yesterday, we completed more than 18,000 new tests in Alberta, which means that our provincial positivity rate has risen to 9.2%. As you heard, sadly, there were 10 deaths related to COVID-19 reported to us in the last 24 hours. My sympathies are with all the loved ones of these individuals and those who have passed away from any other cause. In schools, there are currently active alerts or outbreaks in 397 schools, about 17% of all the schools in Alberta. Currently, these schools have a combined total of 1,537 active cases. This number includes 210 schools with outbreaks, including 96 currently on the watch list. These numbers are all concerning, but there is some good news today. As you just heard, the first phase of vaccine distribution will focus on immunizing a number of key priority groups. I would like to provide some additional context on why it's important to prioritize these people. As with all of our public health recommendations and measures, our goals throughout this pandemic have been to protect the overall health of Albertans and to prevent our healthcare system from being overwhelmed. It's with these goals in mind, and as always, taking an evidence-based approach, that we are initially focusing on Albertans who are at the highest risk of severe outcomes from the virus, or those who have critical roles in healthcare service delivery. We know that long-term care residents and those who care for them have shouldered a heavy burden throughout this pandemic. To date, there have been more than 3,100 cases in long-term care facilities and supportive living sites. And sadly, 64% of our reported deaths have been from among these Albertans. We also know that when healthcare workers are exposed to or contract COVID-19, they are out of the workforce until they are well or their isolation period ends, and of course their own health is put at risk. By focusing on first immunizing these groups, we will reduce some of the demand on our acute care health system. We will also help to safeguard our workforce of critical healthcare workers and help prevent outbreaks which can lead to uncontrolled spread. Most importantly, we will help to protect the most vulnerable citizens in our province and support protection of our acute care health system so that all Albertans can access care. I know the prospect of a vaccine is promising, and this news provides a sense of relief and hope to many, including me. While we plan for this hopeful intervention, we can't lose sight of the tremendous challenge that's in front of us today: rising case numbers and increased hospitalizations. The first 2 vaccines we anticipate receiving both need 2 doses to be effective, with the second dose coming 3 to 4 weeks after the first. This means that full protection will take time to achieve, even for those who are getting it first. Because of this, and because it will take many months to protect all vulnerable Albertans, we must continue to work together over the coming months to keep our numbers down until enough Albertans have received their full series of vaccine to keep COVID under control. The actions each of us take right now are vital in slowing spread and bending the curve as we are each other's vaccine until the vaccine arrives. Thank you, and we're happy to answer any questions.
Before we get started with the Q&A, I'd like to remind those on the phone that we have a lot in the queue today, so please be brief and limit yourself to 1 question. Also, please let us know who you're directing your question to. Operator, can you please put through the first caller?
First question is Don Braid with the Calgary Herald. Go ahead, Don.
This is for almost anybody there. I guess the Premier probably would be best. But the federal health minister said on the weekend that all regulatory procedures had to be followed before the vaccine could be released, and she made a special point of saying there couldn't be any political interference, unlike certain other countries. My question is, this all seems to be a train under full steam already, but how can you be quite clear that these vaccines are going to get regulatory approval? Do you have, in fact, some knowledge of that now, that there will be regulatory approval very quickly?
Well, Don, obviously, all of this planning is predicated on regulatory approval by Health Canada. The federal government has provided repeated assurances of an accelerated approval process where there have been applications. I believe that Moderna and Pfizer are filing their applications for accelerated approval across the world throughout the past few days. And so the Government of Canada has, which on behalf of the provinces, has agreed to use federal purchasing power to coordinate procurement. They have given us repeated assurances to expect our first doses by January the 5th. We hope, best case scenario, that we might actually receive some before then, but we're not going to count on that. So we are basing our planning on the assurances that we are receiving. And I think there are solid grounds on which to have this hope of federal Health Canada authorization and distribution by the pharma producers because of the initial trials. You know, both the Moderna and the Pfizer products have in their trials proven over 90% effective. In fact, I believe that out of 30,000 people who participated in the Moderna trial, that only 11 who received the 2 doses of the vaccine subsequently became symptomatic of COVID, and none of them with severe symptoms, as opposed to, I think, about 150 who became symptomatic of COVID in the placebo group. So that's a very high level of effectiveness, and we hope and expect that will be validated by Health Canada through their approvals.
Operator, can you please put through the next caller?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi there. This is a question for both the Premier and Dr. Hinshaw. Back to this issue of COVID-19 in racialized communities. How concerned are you that areas of the province with high proportions of people who identify as visible minority are seeing higher rates of COVID-19? And do we have any data at all about what's driving that, particularly given the problems with the contact tracing system, which really started kind of right as the outbreak in Northeast Calgary was picking up steam?
Yes, James, we are very concerned about that. It is not a phenomenon unique to Alberta. I believe you can look up Stats Can reports on the correlation between racial communities and unfortunately higher levels of spread, which is we've seen in other countries, and it's I think most obviously connected to issues around social economic status. Obviously, many newcomers, when they start their lives in Canada, it's just a statistical reality. They are typically starting out at lower levels of incomes, and that often creates greater vulnerability to situations like this because of higher levels of housing density. For example, it's also true that many new Canadians are in public-facing service industry type jobs, care jobs, and are therefore more exposed to potential viral spread. Obviously, you know, folks who work in the transportation sector, the food services sector, in warehouses, and in, for example, long-term care facilities, doing critically important frontline work, those are folks that cannot have the luxury of staying at home. And so these are communities which often are more exposed to potential viral spread in the general population, but also higher degrees of housing density, I think, is a critical factor here. And that is why we will be I've given direction for us massively to expand the availability of self-isolation support. One of the key learnings from the large meatpacking plant outbreaks in the spring, largely workforces made up of newer Canadians who are taking those tough jobs to put food on the table for their family, was that many of those workers were living in higher density housing, and that the majority of transmission appears to have occurred outside the workplace. And I think, frankly, we were too late to really focus on that and to respond to it with an effective public health intervention by offering self-isolation rooms, for example, at hotels. So I have directed that we massively expand the availability of self-isolation. So if you're in a home with a large extended family, particularly if it's a multi-generational family with elderly people being cared for at home, and some person gets sick, becomes symptomatic, tests positive for COVID, it can be very difficult effectively to self-isolate. Several people sharing one, perhaps two washrooms. There are higher chances of transmission, and so we want those folks to know that there is support, that they can get 14 days of respite in a hotel. I want to step up the quality of services that we offer, including culturally sensitive food, for example, including better access to translation services if and where necessary, including perhaps some level of health support. For example, the elderly who may have to leave homes in which there is transmission. So that is an action plan that we are working on now to help provide greater support. We are also trying to increase our communications efforts, including through non-official languages, to make sure folks are aware of support like the federal sick pay benefit, that they don't have to go to work if they're feeling ill. And we are going to be working more closely with ethnocultural community organizations, immigrant settlement groups. I spent 40 minutes on the phone with mayors Nenshi and Iveson, talking to them about these issues yesterday, to really put together a collaborative approach to providing maximum assistance to people in those hot zones that are facing very high levels of spread right now.
Operator, can you please put through the next caller?
Yes, the next caller is Tyler Dawson with the National Post. Go ahead, Tyler.
Hey, yeah, I'm just wondering if you guys can tell us a little bit about this field hospital plan and what that might look like, why the request has been made, that sort of thing. Thanks very much.
Sure, thanks, Tyler. So I think we have to remember, first of all, that health officials, especially during a pandemic, are always planning for contingencies. This is not something that's in our current plans, so it's not included in our current plans to increase our acute care bed capacity to 2,250. There were officials who reached out to Red Cross to be able to ask about a tent, and remember that there is already a tent that is already installed in Calgary outside of the Peter Lougheed Centre. So they've begun conversations, but this is not part of our current plans. This is conversations about a contingency plan, which health officials should be doing, both those in the ministry and those in AHS. So anyways, this is a conversation that was had with Red Cross to understand if that was even possible.
Operator, can you please put through the next caller?
Next is Rick Bell, the Calgary Sun. Go ahead, Rick.
This is a question for the Premier. You talk a lot about the light at the end of the tunnel. If you could walk with me to the end of the tunnel, because I think a lot of people will be interested what that looks like after you get through phase 1 and phase 2 and you're into phase 3. So the question I have, which a lot of people ask, I think, is even if this plan goes like a switch, operates like a Swiss watch, when do we get back to something that looks like normal? And what I mean by normal is summer social gatherings, football games at McMahon Stadium, Stampede in July, weddings in August, no masks, et cetera, et cetera. Now, I know you can't be precise, Premier.
Yeah.
Nobody can. But if you could give us some idea of when, if everything goes according to plan, life will return somewhat to normal. And this is a quick supplementary. How will you keep people on board, since that's probably going to be months away? So if you could answer those two, I'd appreciate it.
Well, Rick, I'm not going to fib and say that I know that magic date. And we certainly don't want to give people a false sense of hope. But here is the good news. We believe, based on our current planning and assurances of access to vaccines, that the most vulnerable, the folks who are by far and away most affected by this disease, should have received vaccines by the end of March. And then the next kind of category of vulnerable people throughout the balance of the spring into the summer. And that, I think, will significantly change the whole risk profile in the province. So I hope and believe that by the summer we can get back to summer events. They probably won't be as big, and there will probably be some guidelines and restrictions. We'll have to wait and assess that. But I sure hope that people can get a whole lot closer to free and normal lives by next summer with the progress that we'll make in vaccinating the vulnerable. And but one big just qualifier on that is we don't know for sure. Let's not count our chickens before they're hatched when it comes to this. And until we see a significant percentage of the general population that have also received a double dose of the vaccines, there will likely have to be at least some public health measures and guidelines in place. I think a lot of that we'll have developed a muscle memory about, washing our hands frequently, about things like just hygiene and avoiding situations that can lead to spread. I think we'll have learned a lot of those lessons, but I do hope and believe that by next summer will be a lot less anxiety than there was this past summer.
Operator, can you please put through the next caller?
Next is Jeff Slack. Actually, it appears Jeff has left the queue. I'm sorry. Our next is Julia Wong with Global News. Go ahead, Julia.
Hi, this is for the Premier and for Dr. Hinshaw. Both of you had said that the R value will be a main point of consideration when it comes to restrictions and decision making. However, this number is not publicly disclosed. Alberta Health said it would be posted every Monday, but that doesn't seem to have happened. So how come this number isn't being shared with Albertans?
Well, actually, we'll be discussing that at our next meeting of the Cabinet COVID Committee about what metrics to release and when to release them, with which frequency, as we move towards the weeks and months to come. Similarly, we do hope to release some additional data on the state of healthcare capacity, our efforts to once again expand that capacity. So I would just say, please stay tuned. We're taking a closer look at that. I think if you want to follow a key metric which really helps to inform the RT, it would be the positivity rate. And we've seen that positivity rate bounce around between 7 and 9% over the past week or 10 days. So I think that's a very important public metric that we put out there.
Operator, can you please put through the next caller?
Next is Brenna Rose with CTV News. Go ahead, Brenna.
Oh, I'm sorry, that other question, I'm sorry, Brenna, 1 second. Doctor, Ms. Wong asked if do you want to add anything to that? You're good? All right. Sorry, go ahead, Brenna.
So today, Ontario's health minister referred to Alberta as being in crisis because patients are being doubled up in some ICU rooms. I'd like to get your reaction to that, Premier, and your take. Is Alberta's hospital system currently in crisis?
Well, obviously, COVID is a general public health crisis. Let's put this in context. Right now, we have a little over 500 COVID patients, 97 of whom are in intensive care. And we have a system with 8,500 beds overall. We demonstrated in the spring the ability to open well over 600 dedicated COVID ICU beds and upwards of 2,300 dedicated beds in the hospital system overall. So there's no doubt that many of our hospitals and healthcare workers are under significant strain, particularly in our 17 busiest and biggest hospitals in the two big cities. It's also true that a majority of our hospitals across the province, particularly in mid-sized cities and smaller centres, do not have a single COVID case. So we have been averaging, I think it's about 91% total hospital occupancy over the course of the past month. And AHS is very carefully ensuring that we open up more and more dedicated COVID beds to meet the demand. Unfortunately, the result is we have to cancel a growing number of scheduled surgeries and non-urgent, non-COVID related care, which is why we came forward with the strong measures last week. And that's this is an important wake-up call for Albertans to take it more seriously than ever. And if, in terms of double bunking or so-called double bunking, Minister, would you like to comment on that?
Yes, and this is a safe and appropriate use of ICUs and ICU beds. It's something that is sometimes done in hospitals previously when there are surges of capacity and whether AHS is responding to flu season or otherwise in previous years. So this is something that we have seen in hospitals before, and so it is a safe and appropriate use of our ICUs as we respond to the pandemic. Obviously, as Premier said, we want our case numbers to come down, and when they do come down, we will see our hospitalization and ICU capacity also come down as well. So look, we understand our folks especially in the 16 largest and busiest hospitals, those folks are stressed. Our healthcare workers are doing an amazing amount of work to be able to care for those patients. They're going to continue to do that. But anybody who needs critical care in Alberta is going to get that care in Alberta throughout this pandemic.
Okay, we have time for 3 more. Operator, can you please put through the next caller?
Next is Jason Herring with Post Media. Go ahead, Jason.
Hello, this question is probably for Deputy Minister Winnick. There was plenty of talk today about the vaccine depots needed to store the ultra-cold Pfizer vaccine particularly. But I was wondering if any work had been done to prepare ground transport for the vaccines, vans with ultra-cold storage.
Yeah, there's been an incredible amount of work that has been done by Alberta Health and Alberta Health Services in preparing for this. So we're in the process of finalizing details, but rest assured that that has been looked into and is a priority.
Operator, can you please put through the next caller?
Next is Robert Tuttle with Bloomberg. Go ahead, Robert.
Yeah, hi. This is regarding the field hospitals. I just want to be clear. At what point do you anticipate? I mean, what parameter would need to be met before you go and ask for these tents? And then also the story by CBC mentioned the federal government being also asked. Like, at what point are we going to need them?
Well, look, I think at this point, what's happening is health officials have reached out to the Red Cross, and just to make sure that contingency plan is in place, negotiating a contract so that it's secured and it is available, if and when it is needed, and if it would ever have to be erected and installed in Alberta. That would be up to AHS to make that decision, and so I defer that question to them. But this is not included right now in our current plans. For the need and for us to be able to increase the acute care and ICU capacity that we will be planning to be able to provide for patients and the healthcare workers. So it's not something that is currently we see being needed. It's not in our current plans, but to make sure that it could be a plan that's potentially used in the future, that's why there's the conversation with the Red Cross to at least secure that tent at this time.
Operator, can you please put through our final question?
Final question is Audrey Naveau with Radio Canada. Go ahead, Audrey.
Hi, my question is for the Premier in English and in French, if you could please answer. In English, I'd like to know if you have to call on the federal government and the Red Cross to have potential other field hospitals, isn't that an admission of a failure to manage well the pandemic in the province? And in French, I will repeat. Monsieur le Premier ministre, si vous devez appeler à l'aide le gouvernement fédéral et la Croix-Rouge, est-ce que c'est pas un aveu d'échec de votre gestion de la pandémie dans la province?
No, I think it's a sign of responsible planning on our part for a potential extreme scenario. We were doing the same thing in the spring when we saw places around the world having to convert convention centers into makeshift hospitals. We asked AHS at that time to begin developing contingency plans for that kind of extreme scenario. Thankfully, we've never been close to having to call upon that kind of extraordinary overflow capacity, but it's only I'll go back to the numbers I shared with you earlier. In a system with 100 hospitals and 8,500 beds, where we believe we can dedicate 2,300 of those to COVID patients. We currently have a little over 500 patients. So while there are about 16 hospitals under significant stress right now, and a lot of healthcare workers are exhausted, the reality is that we have and can continue to create capacity, as we expect, quite bluntly, the hospitalization numbers to go up, given the new cases in the last few weeks. But that demonstrates that we're not anywhere at the point of having to call on that kind of overflow capacity. We did set up a overflow emergency ICU capacity adjacent to the Peter Lougheed Hospital in the spring. Thank you to Sprung Construction for their assistance with that. So this is just responsible forward planning, as I believe at least every major province has done in every large population jurisdiction around the world. En français, c'est tout simplement la planification d'une situation potentielle à l'avenir. Ce n'est pas la situation actuelle. Évidemment, c'est tout à fait responsable pour le gouvernement à considérer les besoins d'une situation extrême à l'avenir. Nous ne sommes pas là maintenant dans un système avec 100 hôpitaux et 8500 lits aux hôpitaux. Nous avons actuellement à peu près 500 patients dans les hôpitaux avec le COVID-19. Alors, ça veut dire que oui, il y a quelques hôpitaux sur beaucoup de pression et on est très reconnaissant des efforts des travailleurs aux premières lignes du système de santé, mais cela étant dit, nous avons plus de je dirais à peu près 2000 lits qui auraient pu être disponibles pour le COVID-19 dans le système dans les semaines à venir. Mais c'est tout à fait responsable à considérer les situations extrêmes comme nous avons fait au printemps et comme tous les gouvernements ont fait également. Thank you very much.
That concludes today's media availability. Dr. Hinshaw will be back with another update tomorrow afternoon.